More important than any facility or piece of equipment is having people that have the right catitude. And that involves people that understand cats and know cats and understanding what's normal for cats so that you can embrace cats for what they are. We know that they're not small dogs, so we want to understand cats. And knowing what's normal is really important. Understanding that anything you can do to not heighten their arousal so that they don't get in a situation where they're uncomfortable and feel threatened. Cats are very sensitive to vision. Tiniest movements get them agitated, can get them agitated, and their sense of hearing is 4 times as acute as ours, and their sense of smell is 1,000 times stronger than ours. So understanding that the small things can really cause a cat to become upset or fearful, and then that translates into difficulty in handling them. So those things are important. Certainly understanding their behavior through the American Association of Feline Practitioners behavior guidelines. And finally, with regard to feline-friendly handling, letting the cat do what it wants to do. For example, if you have a scale in your exam room, performing the examination right on the scale where the cat is comfortable. And when drawing blood, just letting the cat be in a natural position. Less is more, and more is less. With feline handling, that's one thing. If there's one thing that a practitioner or a veterinary healthcare team member can remember, that would be it. Less is more and more is less. So those are just some overall guidelines for introducing feline-friendly practices. Feline visits are down, and we know that. It's really a crisis situation. So starting with your own practice and the clients that already come into your own practice, 41% of dog owners also own cats. So to have your healthcare team review the computer files to see if they already own a cat or if the cat hasn't been in a couple of years, that's very, very helpful. Also making your practice look like it caters to cats and be feline friendly in terms of artwork and comfort level, and providing areas where there are places where cats can kind of not be exposed to other animals, cats and dogs. Ushering them right into the exam rooms will help decrease their anxiety level. And just getting the word out about your care for cats by client education seminars on things like litter box problems or chronic kidney disease or even feline heartworm disease, which we now know can infect cats as well, and that's very troublesome. So it would be very easy to train a receptionist to say to a client when they're checking out with their golden retriever, "Mrs. Jones, I see that Rusty gets his heartworm prevention once a month, but do you have a cat Midnight also? She hasn't been in a couple of years. What can I do to help you bring Midnight in? Would you like to borrow a carrier that would be easy?" And those are things that we can do within our own client base and to help educate cat owners that they need health care too.